Hey guys, it's Dr. Perry Sexton from San Diego and Encinitas. Today we're going to be talking about the strategies that you should be taking every time that you're going to treat any kind of a musculoskeletal problem. Whether we're talking about an injury that's happened last month, last year, you name it. Whether we're talking about shoulder pain, whether we're talking about back pain, all of these things should always have three aspects to their approach. Number one, you're going to want to take care of the inflammation. This is the least common denominator that you and I can fix. Realize the injury has already happened, again, whether it's happened last week, last month, or last year. But periodically your body is going to go there and try and fix those microscopic injuries. And the way they do that is by sending a bunch of blood to the area. That is inflammation. And we're going to want to take that down because that inflammation, while increasing your pain, can also cause long-term consequences like calcification and scarring of those joints. So we want to get proactive with this. My favorite ways to treat the inflammation is going to be using medications like naproxen, which is similar to Aleve, or ibuprofen, which is similar to Advil. Make sure you talk to your doctor about how you should be using these because you have to use them consistently. In the case of naproxen, that's twice a day, or in the case of ibuprofen, that's 3 times a day. And so you want to be looking at which one of these is going to fit into your schedule and which one tends to give you the better effects and fewer side effects. So talk to your doctor and work out which ones are going to be right for these. Often people talk to me about, isn't this going to injure my liver? Well, in truth, with these non-steroidal anti-inflammatory medicines, NSAIDs, your kidneys are actually peeing them out without changing them too much. So you don't have to worry about your liver too much with these kinds of things. In truth, Tylenol is actually the one that can cause damage to the liver. But using that at a normal dose on a routine basis will do 0 damage to your liver. It's really only whenever someone uses a huge load of Tylenol, often trying to hurt themselves, that they actually do any damage to this. So as long as you are giving yourself a break whenever you're using these anti-inflammatory medicines and working with your doctor, you should be able to do this without giving yourself problems with things like ulcers or kidney injuries in the future. So keep those things in mind. But we want to take down this inflammation as the least common denominator to try and get this better. Only then should you start looking at how can we take care of the effects of this inflammation. So effects can be things like muscle spasms or pain. And patients are often asking me, hey, can I get a pain reliever to try and take care of this? Should I go see my chiropractor to get rid of these kinds of things? Can I get a muscle relaxant? And often those are not the things that you want to do because they're very temporary effects that you're going to get for those things. The things that I like to teach my patients to do are really to show them specifically with that joint or muscle injury what kinds of stretches are going to be most important to get them the long-term benefits that they can use. How can they use massage techniques to help them improve the pain that they're having and the muscle tension that they're having in those areas? And then only then do we really want to look at what role can and should a pain reliever or a muscle relaxant play in this type of thing. We can address those things specifically later on. Number 3, what are the contributors? What is it that you've done on a regular basis to cause this pain to be worse? Now, if this injury just happened, obviously, that's going to be the sole contributor. But very often patients have had issues with pain from a long time ago, and that pain then causes them to limp or to lean over into an awkward position, at which point that position can then start them in the process of getting more and more muscle spasms, more and more pain, and having more and more difficulty getting themselves out of these kinds of things. So if we find out that your standing posture, your walking posture, your seated posture, if these things are the things that are causing your back pain, your shoulder pain, or other muscle pains to be worse, we've really got to try and get a hold of those problems and overcome them. Sometimes those problems can be overcome just through catching yourself and correcting yourself, but very often it's going to take overcoming years of habit making and trying to build up new strength in other muscles that can compensate for these and prevent you from getting the pain and actually make it so that it's automatic for you not to stand in those postures that are going to give you those kinds of problems. And so after we've worked on those postures, very often we will reinforce them by getting you doing specific exercises at the gym in order to build up the muscles that will accommodate that kind of posture. So keep these 3 aspects in mind whenever you are looking to treat your musculoskeletal problem, whether you've seen your doctor yet or not, because you're going to want to address each of these things in order to know that you are moving forward with your progress on this medical problem. Good luck, and I'll be with you there as we try all of these on individual muscles. Good luck.